A synovial joint is where there are articulating bones that are separated by a joint cavity. And there's a lot of anatomy that goes along with this joint cavity. Remember that synovial joints are freely mobile, so we classify them functionally as diarthroses. So common examples of synovial joints include the shoulder, the elbow, as well as the knee. So let's take a look at the general anatomy of synovial joints first. The first of which is that there is an articular capsule, which contains two different layers. There is an outer fibrous layer made up of dense, regular connective tissue with the function of strengthening the joint. Then there is an inner synovial membrane, which plays a very important role because it is secreting lubricating fluid called synovial fluid. The next structure is articular cartilage, which is, remember, a type of hyaline cartilage that's covering the articulating surfaces. This is very important because it reduces friction. It also acts as a shock absorber. Then there is a joint cavity. This is the only type of the three groups of joints that actually has a joint cavity. The joint cavity is a space between those articulating bones. And within this joint cavity, there is a small amount of synovial fluid, which plays several roles. It lubricates the articular cartilages. It nourishes those cartilage cells, which are called chondrocytes of that articular cartilage, helps to absorb shock during compression of the joint. So, when we warm up before exercising, one of the important reasons for that is we start to mobilize the synovial joint, which is found in the joint cavity. Also, surrounding the joint are several different supporting structures, such as the ligaments, which connect bone to bone. The ligaments, as you'll recall, are dense, regular connective tissue, and they help to strengthen, reinforce the joint capsule. There are also other ligaments which are found outside of the capsule, which we call extrinsic ligaments, as well as intrinsic ligaments, which are thickenings of the capsule. So, a really good example of this would be in the knee joint because there are collateral ligaments. The collateral ligaments are the extrinsic ligaments, whereas there are also what are called cruciate ligaments. You've heard of the ACL or the PCL before. They are inside the capsule itself. In addition, there are specific sensory nerves which detect pain and stretch, and of course, blood vessels that nourish the joint as well. So this diagram is showing us what a synovial joint looks like. So let's take a look first at the articular capsule, which is always composed of two different layers. The outer layer is the fibrous layer, and the inner layer is the synovial membrane, which produces synovial fluid. There's then found articular cartilage, which is at the ends of long bones, a type of hyaline cartilage. And one of the damaging types of injuries within joints is that the articular cartilage breaks down and the ends of the bones are coming in contact with each other, which is very, very painful. We also see the extrinsic ligaments which would be like collateral ligaments in the knee joint. Also shown is the outer membrane for long bone called the periosteum and yellow bone marrow inside, which recall is lipids. Other anatomy that's found in the synovial joints includes very strategically placed sacs of synovial fluid. These sacs are outside most synovial joints where ligaments, muscles, tendons, or bones may rub, and they're named for their specific location, and they contain synovial fluid. Another structure which is similar to a bursa is called a tendon sheath. It's an elongated bursa around tendons, and especially in confined areas such as the wrist and the ankle, where tendons may rub together. The way it actually looks is if you imagine the tendon being a hot dog, the hot dog bun surrounding the hot dog would be analogous to the tendon sheath. And then there's also packing material in the form of fat pads, which provide some protection as well. So when we classify synovial joints, these are going to be responsible for the multiple amounts of, or the majority of the articulations in this chapter. They're classified by the shapes of the articulating surfaces, as well as the amount of movement that's allowed. So the first way we describe them is based on the number of planes or axes that they move in. And if they don't move in any of the axes, we call them non-axial. And there is basically a slipping movement that occurs. If they move in one plane or one axis, we use the term uniaxial. If they move in two different planes, they would be called biaxial. So an example of a uniaxial joint would be something like your elbow, which can flex and extend, so it moves in one plane. An example of a biaxial joint would be something that not only can flex and extend, but can also abduct and adduct. The multi-axial joint is going to be one that moves in three planes or axes, and this would be like the shoulder joint or the hip joint. So we can classify synovial joints from least mobile to the most mobile. And there are six classes, and they're sort of based on the shape of the articulating parts of the joints. So the first one is the planar joint or plane joint. Notice that it is uniaxial, allows side to side movement. Then there is a hinge joint, which is also uniaxial, like the hinge of a door. A pivot joint, which is uniaxial, so one bone rotates on its longitudinal axis. This would be something like the atlas and the axis, allowing us to rotate our head. Then there's two biaxial joints. There's one that's called a condylar joint, where there's actually a concave surface and a convex surface, which are going to articulate with each other. A saddle joint, which we would find in, for example, the thumb, where the joint surfaces actually resemble the saddle that goes on a horse, and the other one would resemble the shape of the horse. The last one is the multi-axial joint called a ball and socket joint, where there's a spherical head that fits into a cup-like socket.